Considering the case of Demetrius Manderfield, I found my ethics towards healthcare in America quite challenged. I've generally held the view that the free market can take care of most issues of products and services. That is, the forces of supply and demand will ultimately meet in a fair exchange of goods and services that best meet in accordance with the greater good of society as a whole. Referring, of course, to what Adam Smith referred to as an invisible hand that guides the economy towards the best possible good. But considering economic theory, it is important to remember the work of John Maynard Keynes, who proposed that in some cases, government intervention is needed. Perhaps healthcare is an area where government meddling in the economic framework is justified. As a reminder to the viewer, Manderfield was arrested and held in jail for nearly 5 months without the proper health care needed for his chronic, life-threatening health conditions. Had Manderfield not been incarcerated, he would receive blood transfusions every 3 weeks along with pain management medications. Evidently due to some combination of government program and Manderfield's own resources fitting the bill for the care. Since he was arrested last December, Manderfield has been denied that treatment by prison officials and physicians. He was simply given ibuprofen for his life-threatening pain. You and I together in our lives, sacred ties will never fray. Then why can't I let myself tell lies and watch you die every day? What happened with Manderfield occurs often. A study by the Department of Medicine, Cambridge Health Alliance, states that among inmates with a persistent medical problem, 13.9% of federal inmates, 20.1% of state inmates, and 68.4% of local jail inmates had received no medical examination since incarceration. This study is a wearisome conclusion that many inmates with a serious chronic physical illness fail to receive care while incarcerated. In an American Medical Association Journal of Ethics article, Dr. Joseph Paris uses a logical argument to contend that inmates should be given health care. Dr. Paris sums up the ethical issue. He writes, "It makes sense from a legal, ethical, and social public health point of view to provide health care to prisoners. But doing so creates the perceived injustice that those who behave badly are rewarded with free medical care, while those who soldier on, working for low pay and resist the temptation to resort to crime, are punished by not receiving free care." It is an essential point. Why should inmates receive free health care when the citizens who are out there busting their humps and obeying the law must pay high prices for their health care? If we are not to provide the unincarcerated with health care, then it is certainly an Eighth Amendment paradoxical obligation that we are to provide inmates with health care. Many countries around the world provide their citizens with health care, and the fact that the U.S. lags behind riles a number of people, writes Paris, and especially those who understand how universal coverage applies to all U.S. prisoners. Paris goes on, "This dilemma will persist until health insurance is available to all U.S. residents. Meanwhile, coverage of all U.S. prisoners continues, and it is a good thing, according to Paris." Again, the Eighth Amendment protects prisoners from cruel and unusual punishment, such harsh punishments that do include the denial of health care while incarcerated. But if the Constitution obligates us to provide free health care to inmates, logic implies that we are also obligated to provide free, law-abiding citizens with such care as well. Fairness and justice being applied here. It is my understanding that Manderfield is currently receiving the care he needs. But this was only a result of his mother going to the media and relentlessly petitioning the system to fulfill its obligation to ensure Manderfield was provided his Eighth Amendment protections. Had Manderfield not been given such protections, he would have been given a death sentence, even before he was ever convicted of the crime for which he is jailed for. The fight that the mother had to endure, although courageous, seems to be unnecessary since the constitutional protections are very clear. Rabbi Joshua Levine Grader recently wrote on the ethical and moral right to individuals to have proper health care. He writes, "We spend more on health care than any other industrialized nation, and we're not even in the top 20 of nations in regard to health and mortality rates. We live in the wealthiest nation on earth, the wealthiest nation in the history of the world, and millions of our citizens can't see a doctor. 45,000 of us will die each year because of lack of health care. This is a moral outrage, a moral disgrace, and a moral ineptitude that is no longer tolerable." After studying the case of Manderfield in great detail, I have come to the ethical conclusion that inmates deserve health care that can only be provided by the very government that has incarcerated them. In addition, I have expanded my view on universal health care. If inmates deserve government-funded health care, then so do us all.